Have sex, get UTI. Have sex, get UTI. Guess what happens again? Some of you have sex and get UTI. Why does it happen? Why doesn't it happen to guys? Hi, I am your local OBGYN. I love women, and let's talk about this. So anatomically, men and women are obviously very different, but when it comes to their urethra, which is the connection from their bladder to the skin on the outside that you can see where the pee comes from, women's urethra is about 4 centimeters or so, whereas men's is really the whole length of their part. That being said, the proximity of the outside skin to the inside of the bladder is quite close, which means it is much easier for bacteria to get into the bladder before it gets flushed out, hopefully with urine. So when we have intercourse, there's a whole mixing of bacteria when we talk about, skin to skin and things like that, which increase the rate of bacteria getting into the urethra and then traveling even further backwards just from the intimacy part that you guys are experiencing, going into the bladder and causing the infection. What should you do? Okay, pee after sex. All of you, please pee after sex. That's number one. Number two, if you do have vaginal atrophy, consider adding something like vaginal estrogen to help that area. You can do probiotics, which can be beneficial in balancing the type of bacteria that is on the outside of the vulvar area, which can be good. Some women will end up on something like cranberry pills daily or some sort of acidifier of their urine that sometimes is prescription, or some companies make things that can reduce the risk. If it's really bad, some ladies will need a single dose of antibiotic after intercourse in order to truly reduce the risk of infections after sex.